best part of being a member of the Sentara Cancer Network is that you have a consistent group of people who are dedicated to taking care of lung cancer patients.
The Sentara Cancer Network is special because of the people. We have a wonderful range of specialists who are superbly trained to focus on providing sort of 360-degree care.
In the Sentara Cancer Network, we do have navigational bronchoscopy in different sites. We have endobronchial ultrasound, we have thoracic surgery. So it brings an added value is that those services are available rather than having to send them to distant sites.
And interventional radiology can do minimally invasive procedures with just a small needle, go into the lung, biopsy the nodule, and do it all within a same-day procedure without having general anesthesia. This can give us diagnoses, this can help us to aid in treatment, and this can move things along a lot quicker than, let's say, a surgical biopsy would.
It's important to have a correct diagnosis because every individual cancer in the lung, just like individual people, are different. Some may look very similar, but they have different molecular makeups. Our pathology group is rather unique in that we collaborate with each other and share cases and have lots of internal consultations. And by doing that, I think we provide a unique product.
We do have a strong network locally. We're able to perform some more esoteric tests, so tests that would be too expensive for a normal community hospital to perform. We have a volume to support that testing being in-house, so we are able to do a great deal of molecular pathology and molecular microbiology in our lab.
Lung cancer screening, I think, is going to change the face of lung cancer. We've never had the ability to detect cancers of the lung early when we could surgically remove them and offer you a cure.
If a patient has a positive screening test that then leads to a cancer diagnosis, we have all the professionals here within the Sentara Cancer Network that are needed to take that patient through their care from start to finish.
Lung cancer program, we've had a lot of innovations in recent years with minimally invasive approaches such as what we call VATS, lung resections, and these allow the patients to recover several weeks more quickly.
Certainly with patients with lung cancer, we recognize that some patients are not capable of having operations. And in those patients who are particularly medically inoperable, we know that high doses of radiation, particularly delivered by technology like CyberKnife, can be quite effective compared to more conventional types of radiation. We are participating in trials that use non-surgical techniques versus surgical techniques, and even participating in trials that determine how much surgery someone needs in some of these smaller lung tumors.
We have molecular targeted therapy in trials. We have immunotherapies, chemotherapy in combination, radiation oncologists, surgical oncologists, many aspects of clinical trials.
Well, every Sentara hospital has care coordination for all patients, and they know that they have somebody they can call on to help them through the whole process.
Well, to put it simply, none of us is smart as all of us. And when we come together, we all bring our particular expertise to make sure that these patients get what they need to try to defeat this illness.
The Sentara Cancer Network is a broad program that addresses any patient that has a cancer anywhere, but the network brings together experts, whether surgical, oncologic, radiologic, to address and to tailor the treatment to that patient's specific needs.
The patients that I take care of are the best part about my job. I see them through the beginning of the treatment all the way through the end of the treatment. It's nice to have that lung cancer program within the cancer network because it's very well diversified. It's a well-oiled machine, if you will, in getting patients through and getting them to either surgery or just definitive treatment, whatever it may be.